Well, hello and good evening to everybody. I feel quite strange, even so many months in, getting used to having an event under the circumstances of all this new technology, but I think we're there and we're live. So welcome everybody who's watching to this time. Us this evening. We'll speak to you in just a second. Just as I said that, it says on my screen my internet connection is unstable, so I hope that I'm still coming through okay. These are the perils of doing these things at home, isn't it? I've got dogs around me and a toddler sleeping upstairs. Nothing's going to go wrong, I'm sure. So let's crack on and hope for the best. So as I said, welcome this evening. This is one of a series of events being held by the Welsh Parliament as part of the GWLAD series of events, which some of you may have caught up already through YouTube. They're there for a month after they've been live, and I've seen a few of them. They've been really interesting, everything ranging from looking at farming life to the arts sector to all sorts of corners of Welsh life. And I'm pleased to say tonight that I'm hosting this event, which is celebrating key workers. Usually I'm doing the news for ITV, and that has been, shall we say, rather gloomy of late this year. So I haven't been able to bring you particularly pleasant news, although we do try and bring you as much light and shade and celebration in the programme as we can. Tonight is really lovely because hopefully this will be a chance to showcase the work that you've all been doing throughout this pandemic and really celebrate what you've been doing to keep Wales going. Really, so thank you very much. We've got representation on the panel this evening from health, education, the religious and community sectors, and the care sectors, of course. So I'm going to be going to each panelist in a minute to introduce themselves. Before that, just a little bit of housekeeping from myself. That's if you need translation at all when panelists are delivering in Welsh, then you can go to the bottom of your screen towards the right and you should see a translation icon. And on that icon, you just need to switch it to English on the tab so that you'll get that translation. And the other thing is, lots of questions have been submitted already, and we'll try and cover those as we go, and I've got some of those. But if you want to submit a question live, you can use the live Q&A function. And for those who are coming to this for the first time, that again is on the bottom bar of your screen under Q&A, and you can type your question in there as we go. So in no particular order, if I can come to our panelists to introduce themselves this evening, let's start with education and with Menno Davies. Menno.
Mustafa, fenw yw Maynard Davies. Dwi'n bennaeth cynorthwyol yn Ysgol David Hughes, Porthaethwy, Ynys Môn. Ymhlith fy nghyfrifoldebau mae safonau a lles aelodau chweched dosbarth yr ysgol. Dwi'n athrawes addysg grefyddol ar ran fy nghefndir, bellach yn dysgu tystysgrif her sgiliau yn yr BAC. Dwi hefyd yn gyfrifol am ddarpariaeth iechyd a lles yn yr ysgol, felly dyna'r meysydd sydd yn bennaf o ddiddordeb i fi.
It must have been a really busy and challenging period for you, no doubt. Ahmed Ali, if I can come to you next, please.
Hi, my name is Ahmed Ali. I'm the Imam at the Al-Ikhlas Center in Adamsdown. I am the Imam as well as the Youth and Food Bank Coordinator, and also dealing with youth activities and programs.
So a bit of an overlap with mine here as well in terms of dealing with young people too during all of this. I'm sure you'll have lots to share throughout this evening. If I can come next to Rachel Jones.
Hello, my name's Rachel. I'm the registered manager of Tŷ Mae'r Care Home in Llanelli, Carmarthenshire. We've got 74 beds here, so we look after the most vulnerable in society.
And I know your experience is no doubt going to overlap a little bit with Dr. Biswas as well. If I can come to you to introduce yourself as well this evening.
Good evening. My name is Raja Biswas. I'm a physician based in Royal Glamorgan Hospital, which is near Llantrisant. So since March, like everyone else's life, my life has also changed a lot. And I can exactly tell you it changed from March 20th when my first patient was admitted into the hospital. So it's been a constant roller coaster since then. And August, I thought things were getting better. Unfortunately, we have had the second wave now. So we are just going through it. But fingers crossed, with the vaccine and a lot of positive news, things might change in the new year.
Maybe I can just pick up with you as you've talked about your experiences so far. That's something I'm going to be asking everybody. So maybe I can just pick up a little bit more for you to expand upon that in your personal and professional life. I know you've also had the experience of contracting coronavirus yourself as well.
Oh, yes. So I've had experience from all angles. I'm quite well known to call COVID by now, because as a clinician, I have been looking after patients with coronavirus since March. And I have looked after a ward full of patients from March onwards. And I thought it had got better, but now again, I have a ward full. A lot of patients have recovered now with COVID at the moment. I also have a managerial kind of role. I'm a clinical director for the medicine in the hospital, so involved in trying to set up the services and develop the services. And lastly, I've had COVID myself, so that has been quite a tiring experience. Took me about a month to recover. So I've had quite a broad experience with the virus.
And were you able to take time off to make sure you recovered properly at that point?
I took about 10 days off, but the situation was such that I had to come back really before I completely recovered physically. Although the virus was gone, it was quite a tiring time. But with my colleagues and everyone struggling, really, it didn't seem right that I'll be sitting at home. So yeah, I did come back.
Well, we thank you very much for your work before and after that, and we're glad to hear that you're feeling better
much
now.
better.
Anyway, good, glad to hear it. Rachel, what's your experience been staying with the care theme at the moment? We've heard so much about care homes, particularly in the news recently, I think, as well, and the harrowing experiences of people being separated from their loved ones for such long periods of time. How has this last few months been for you, and how have you negotiated all of those things?
I think similar to what Raja just discussed, everything changed for us here in March as well. We went on lockdown 2 weeks before it was guidance to go on lockdown to try and protect our residents. But nonetheless, at the end of March, we had our first case, and that quickly increased to 4, and we were declared as having an outbreak here. Over half of our staff here at Mae'r during that time also contracted coronavirus, with a number of them quite poorly. And similar to what Dr. Raja said there, we all pulled together. My mother-in-law passed away at the start of the pandemic, not related, but similar to what Dr. Raja said there, I couldn't stay at home, so I came in. We had one of our staff members' mother passed away here right in the midst of the pandemic, and she was back in work the next day looking after the residents that couldn't have their own family members with them. And I think it's just a credit to the team we've got here, and not just here, but in health and social care sectors across Wales, that we have really stepped up and become the family of our residents. And I think that's the only comfort that the relatives have at that time, is that we are able to step in for a little while and become their family.
Can you say a little bit about the red zones as well, which you were involved with?
Yeah, so at the start of the pandemic and at the start of our outbreak here, I came in on a weekend, and as you can imagine at the time, we'd never faced anything like it before, and I think right at the very start there, we were all sort of just trying to think the best way that we could get through this. And I came in, and I remember sitting with Paula, my deputy, and just saying, we're gonna have to do something. We're gonna have to set up red zones. We're gonna have to isolate all those residents who are symptomatic or have been tested as positive for COVID. We're gonna have to keep them in one area of the home. And more importantly, we're gonna have to speak with our staff and see who are willing to work in that area of the home. And that's exactly what we did. We came in over a weekend, maintenance staff, admin staff, we were all in, and we set up red zones within the home. We we sectioned off certain areas, we changed bedrooms around. Obviously, it's so much difficult in a care home. In a hospital, it's, you've got a bay and there's not much there's not personal items and things there, but this is home to our residents, we've got residents who have been here for 15 years and their rooms are their home. But nonetheless, we did it. We put red zones in place, and it later became Welsh Government guidance then, that all homes tried to follow the example that we'd set. And I played a part in some of the local homes in going there and mentoring them to set up similar. And it did result in us being able to keep COVID in certain areas of the home, and thankfully we had those staff who were willing to work in those zones alone. They didn't come out of there during the day. They'd spend a full 12-hour shift in full PPE, as did all of the staff at the time. And we were very, very lucky in that we're a private run home, and our owner provided us with probably more PPE than some other places had, and we were really lucky that we were able to keep the majority of our residents and the majority of our staff safe.
Yes, it's very hard to imagine how you deal with those logistics on such a scale, but also when you're talking about people's safety and people's lives amongst that. And I'm sure that's something at Minor Davis you've experienced with preparing for pupils to go back to school, just that weight that's on you of responsibility as you knew that schools were going back. How did you manage that?
Fe oedd Ynys Môn mewn sefyllfa chydig bach yn wahanol yn yr ystyr. Fe arhoson ni ar gau am fis ychwanegol oherwydd fi oedd na achos eitha sylweddol o Covid ar yr ynys. Felly, un diwrnod yn unig gafodd disgyblion i ddychwelyd i'r ysgol ym mis Gorffennaf. Hynny yw, un wythnos fuon ni ar agor, a fe gafodd y disgyblion i gyd un diwrnod. I ni, y flaenoriaeth bryd hynny oedd edrych ar iechyd meddwl disgyblion. Oedd yn ddiddorol iawn gweld y disgyblion yn cyrraedd yr ysgol er enghraifft. Doedd ddim yr un bwrlwm, doedd disgyblion ddim yn mynd at ei gilydd a yn llawn sŵn a sbort yn y ffordd y bydden nhw fel arfer. Ond yn raddol fach, fe oedden nhw yn dechrau agor allan ac yn dechrau siarad mwy. Fe oedd ar y cychwyn falle, o'n i'n gweld nhw mwy ar ei ffôn er enghraifft yn hytrach na ymwneud â plant eraill sydd yn naturiol wrth gwrs. Ond erbyn diwedd y dydd, fe oedd y plant wirioneddol wedi mwynhau cael bod gyda'i ffrindiau, i athrawon hefyd wrth gwrs, ond yn bennaf i ffrindiau dwi'n credu, ac wedi cael cyfle falle i edrych ar beth oedd y pethau wedi bod yn digwydd ym mywydau bobl dros y misoedd diwetha. Dwi yn teimlo bod wedi bod yn bwysig bod ni wedi ffocysu falle llai ar eu haddysg nhw am ddiwrnod ac yn fwy falle ar eu iechyd meddwl nhw. Yn ddiddorol iawn bore yma oedd cyfarfod llywodraethwyr gyda ni a oedd y prif ddisgyblion yn adrodd i'r llywodraethwyr ac yn nodi bod nhw wedi teimlo bod hwnna'n rhan bwysig iawn o'r broses dychwelyd i'r ysgol. Ar ôl dychwelyd y mis Medi, neu yn wir yn yr haf, achos fe fuodd llawer iawn o'r staff yn gweithio trwy'r gwyliau haf wrth gwrs, oherwydd dath y canllawiau ar gyfer ailagor y mis Medi ddim tan nos Lun, dwi'n meddwl, cyn i ni gau. Felly oedd y broses o baratoi'r ysgol yn ymarferol o ran system un ffordd er enghraifft, ac yn addysgol o ran pethau fel amserlen a sut i leihau symud o gwmpas. Y rhan anoddaf, dwi'n meddwl, o'r gwyliau haf oedd delio gyda'r canlyniadau, oherwydd fe fuodd honno'n ergyd fawr iawn i ddisgyblion lefel A gafodd set o ganlyniadau o nhw na ni ddim yn disgwyl. Felly fe oedd hwnnw'n gyfnod heriol iawn, dwi'n meddwl, i ddisgyblion, i athrawon ac i rieni.
And how has it affected your staff, do you think?
Dwi'n meddwl pan ddath y canlyniadau lefel A, bod yna ymdeimlad o moral yn isel, bod ni wedi gweithio'n galed iawn y mis Mai i ddilyn y canllawiau, i osod targedau oedd ar sail barn broffesiynol, i edrych ar y treigl 3 mlynedd fel y gyfynwyd i ni wneud, a wedyn bod disgyblion o'n un amcangyfri y dylen nhw fo'n cael A neu B yn cael D. neu yn achos un disgybl, oedd yr amcangyfri yn fe gafodd e I bydol, felly oedd y disgybl yna'n methu'n llwyr. Fe oedd hwnnw'n broses anodd, dwi'n meddwl, I athrawon, oherwydd oedd I gwaith caled nhw wedi I ddiystyru o'n i'n teimlo. Ar y llaw arall, fe fi oedd yna rhywbeth bethau positif iawn, fe fi oedd y cyfnod yn agor yr canolfannau hwb, enghraifft, sef fe fi oedd yr ysgol ar agor yr holl amser wrth gwrs, bod I falle'n ffisegol ar gau I blant, fe o'n i'n dysgu ar-lein, a hefyd oedd yr canolfannau blant bregus ac I blant weithwyr allweddol ar agor. A fe fi oedd agwedd y staff yn rhedeg rhywbeth oedd yn wahanol iawn I ysgol arferol, yn eithriadol o bositif, fe fi oedd na frwdfrydedd, fe fi oedd na gyd-weithio, a dwi yn teimlo bod moral yn ystod y cyfnod hwnnw wedi falle bod yn uwch. I ni wynebu cyfnod anodd eto, wrth gwrs, oherwydd yr holl ansicrwydd nawr o ran beth fydd yn digwydd yn lle'r aroliadau. Mae yn anodd iawn oherwydd fel staff I chi ddim eisiau bod eich gofid chi a'ch stres chi yn cael dylanwad ar y disgyblion sydd yn barod yn poeni.
Thank you very much. And I'm sure those are concerns that are reflected right across our communities and are shared by parents alike. Ahmed, what are you seeing? What have you seen throughout the pandemic in terms of the work you're doing in your community, and particularly with young people as well, I suppose, because I know you work closely with the young people in your community. Minor there spoke about a nervousness, spoke about challenges, but also spoke about some positive things to come out of it. Would you share those thoughts as well with what you've seen?
Yes, as an imam, my role involved communicating and engaging with all range of ages, from young people to middle age, even sometimes to people who are in old ages. And because my dealings with these youngsters, of course, this pandemic has affected the relationship so much, because once you see youngsters going through problems and difficulties, and because of the restrictions of communication and physical involvement, that you're unable to do anything apart from speaking to them on the phone. And sometimes it is very difficult, trying to clarify and resolve an issue of a particular person over the phone is very difficult. And they insist on seeing you live, physically, and which is very difficult for me to do so. So it puts a person in a very awkward and difficult position. And also with the, the relationship, as they used to come to the center and do various type of activities, they are not used to the lockdown issue. And because they are, especially youngsters, they are used to the fact that they have the freedom to mobilize around. And when lockdown came, it affected them socially, psychologically, and some of them, they went through a tremendous depression. And seeing them going through this problem and dilemma, and then you are on the other side of the wall, unable to guide them, to help them, it does makes a person feels very sad and locked, handed, and able to do what he usually used to do with them in reality. But on the other hand, of course, we try to do whatever we can, helping them even behind closed doors. And I hope that this problem is to be elevated, so that they can, we can have the ability to communicate with them, and then to be there for them as better as we can.
How did you find it affected you personally?
My personal experience in this, it was very challenging, because when when places of worships being ordered to go in lockdown, this has immensely affected the financial side of the center, which of course affected all employees, which psychologically impacted some of the lives of the employees. And so, as a self-employed myself and a dad of 4, it was pretty challenging financially, like many other self-employed, hard-working people. And on the other hand, is that I felt that it is my duty to be there, despite the center is suspending some of the services. but it was also a duty for us to be there to serve the community in terms of providing food bank parcels services. But it was pretty challenging.
And just looking at another aspect now, I know one of the questions we had in ahead of the event was people really wanted to know whether you and your colleagues felt well supported and cared for, but also, do you feel that the public's perception of what you do has changed? Maybe you can pick up on both of those things, Ahmed.
Yeah, as a team member working at Al-Ikhlas Center, me and my colleagues supported each other and tried to positively influence one another in order to maintain the team spirit. I remember when the first lockdown was introduced, all places of worship alongside other sectors were ordered to close. As a team at Al-Ikhlas Center, we discussed whether we should or we should not close. Then we decided to suspend all activities except the food bank service. So then we saw it being, as we saw it being essential. And I was very proud of my colleagues who volunteered to serve the community and to continue serving the community during this difficult time. And then we managed to provide various services to the community until now. And also, yes, this pandemic has changed the perception of the community, when it comes to the center and improve the relationship. It has also, like I said, it has caused a negative side, but there is also a positive side to this. And we've been having a very good relationship with others, opened a positive relationship with members in the community, especially our neighbors, who supported us with many donations once they recognized the effort that we have been contributing to our wider community. We also established a very close relationship with Jenny Rathbone, who is an assembly member. She is still up until now supporting our work and is there working alongside with us. We also established a positive relationship with Cardiff Council, who used to refer people to use our services during the pandemic. We had a good link, a good relationship with Cardiff Sasson Rugby Club, Fairshare, Neighbourly, and also a Word for All, and many other sectors. So it has been challenging, but at the same time, it opened up a good page with our neighbours and with other sectors in our society.
Yes, as you say, on the one hand, it may have been very isolating, but on the other hand, all these new connections have been born, which has been fantastic in other ways. Does anyone else want to pick up on the feeling of the support you've had amongst your colleagues, but also maybe the change or in public perception during the pandemic of what you do? Rachel, you've got your hand up.
Yeah, I think for us, care work, speaking on behalf of, the wonderful men and women that I work with here, care work is often classed as unskilled. It's something that people think that individuals go into on a whim, and it's not something that you put too much thought into. I mean, I class myself, excuse me, as very lucky to work with the people that I work with. They're very skilled in what they do. And it's sometimes a thankless job, but what they've done during this time, I think it's finally being seen as a skilled profession. People are seeing what it is that we do for people, what my colleagues come in and do for people every day, the sacrifices they make, especially during this time, and the support we've had from the community has been unbelievable. If I'm honest, we've used social media a lot during this time to keep in touch with our relatives, our residents' relatives, sorry, and through that, we've had lots of people messaging us and getting in touch, and it's not just the local community who have been dropping off gifts and cards. And they were all out here at 8 p.m. every Thursday night clapping our staff as they were coming out or coming into shift. But we've had chocolate koalas delivered from Australia from somebody who was following us on social media, and we had crocheted gifts and cards come from Germany. pen pals from all around the world for our residents, and that's something that's really kept them occupied during this time. And the support we've had, it really has been incredible, and it's kept not only the morale of the staff up, which it really has done, but also the residents, that there are people out there who care and who want them to get through this and see them on the other side. And that's just been wonderful.
Oh, truly international response. Dr. Biswas, you must have had a similar feeling, perhaps, I don't know, on those Thursday nights when the clapping for carers began. How was that for you? How did it make you feel in your profession?
I think the clapping for carers was really good. I think it lifted the morale of all NHS workers. And to be perfectly honest, the NHS has done a fantastic job. And the reason it has done a fantastic job is because the people who work in the NHS and the support which has been there between the colleagues is something which, unless you are there, you cannot appreciate. It is really, everyone has worked for each other. The nursing staff, the paramedics, everyone has gone beyond what they should be doing. Some staff who are never mentioned, people like working in the domestic department, IT sector, who run the hospital, and without whom the service would be grinding to a halt. So usually, the doctors and the nurses get a lot of accolades and the clapping, but the other people who are there are equally responsible for doing the service which keeps it running. But one thing I wanted to mention is, this clapping which goes on, which is very nice for the morale. But I think if you speak to most NHS workers and to a lot of the colleagues, no one considers themselves as heroes or angels, because I think there is a very fine line between being a hero to a villain and an angel to a devil if things go wrong. But I think most of the time it is, most of us are professionals who are well trained, and we would like to be appreciated for the work that is done, which is done because we are all pulling together and doing something which we have committed our life to doing. And I think that is important to understand. And I'm hoping that, the perception which has been given to the NHS will boost the staffing in the future, because that's what it will be needed going forward. So I think I'm hoping that there'll be more people who will be coming into nursing or into medicine or paramedical staff.
Oh, that's really interesting. I'll pick back up with you on that point in just a moment, if I may, because we're going to be looking a bit more to the future and what you'd like to see change, perhaps, and what needs to be done. Minor, it must have been the same in education, I guess, that you feel like it's a real team effort. And that, and I know that I heard a lot of people say when they were going through that period of having to do more homeschooling, they've never appreciated what teachers do more. So I guess you must have found that people were really getting a new sense of what you do and appreciating it.
Oes, dwi'n meddwl ar lefel bersonol o'n i adre ac yn dysgu fy hun fel athrawes gynradd, ond o'n i hefyd yn cymryd dyletswyddau bod yn athrawes gynradd i fy nai o blant i. Felly mae gyda fi fwy o werthfawrogiad i beth yw bod yn athrawes gynradd bellach. O'n i tan heno, gweud y gwir, wedi anghofio am yr holl sylwadau fi oedd ar y cyfryngau cymdeithasol am talwch mwy o arian i athrawon, rhowch mwy o wyliau i athrawon, dwi'n shattered. A dwi'n meddwl bod wedi bod yn bit da, dwi'n meddwl bod bobl falle'n deall mwy, bod i ddim yn swydd hanner awr 8 tan hanner awr wedi 3 gyda gwyliau hir. Yn sicr oedd rhieni yn werthfawrogol iawn pan oedd y galwadau ffôn lles yn digwydd. Yn aml iawn fydda'r sgwrs cyn cyrraedd y plentyn, fe fi'n y sgwrs hir gyda rhieni. Oedd wir yn gwerthfawrogi y gefnogaeth oedd eu plant nhw yn cael. Felly dwi'n meddwl ar ran canfyddiad, dwi'n meddwl bod yna fwy o werthfawrogiad, dwi'n meddwl bod yna ymateb da wedi bod, cefnogol iawn wedi bod. Hyd yn oed gyda'r newidiadau yn yr ysgol, mae llawer o'r newidiadau yn anodd iawn i blant. Goffod gwisgo mwgwd, goffod aros mewn gwersi am amser hir yn hytrach na symud trwy'r dydd fel fydden nhw fel arfer. Mae ymateb plant a rhieni wedi bod yn eithriadol galonogol bod y newidion yma yn anodd iddyn nhw. O ran yr cwestiwn ynghylch cefnogaeth, dwi'n sicr yn meddwl bod yna gefnogaeth wedi bod. Dwi'n meddwl fel awdurdod addysg fe fi Ynys Môn yn gefnogol dros ben o ran cynghori, o ran helpu baratoi canllawiau, o ran cydweithio rhwng ysgolion ar yr ynys hefyd, oherwydd oedd pawb yn neud hwn am y tro cyntaf, pawb yn creu o'r newydd. Fe oedd y rhwydwaith penaethiad enghraifft yn cwrdd bob nos ac yn cydweithio, a dwi'n meddwl falle bod hwnnw wedyn wedi ffrydio lawr i'r staff cyfan o ran cefnogaeth y pennaeth i ni, o ran cefnogaeth athrawon i'w gilydd. Felly, dwi ddim yn meddwl bod yna erioed wedi bod gymaint o'n deimlad o dîm yn yr ysgol, ac sydd wedi bod yddi ar mis Mawrth.
It's really good to know that there's been such strong collaboration and support amongst in your sector and from outside of your sector as well. Thank you very much for that. Is there anything any of you would like to add to that point, just on support and public perception, before I move on to the next discussion point? Okay, in that case, we want to get as much as we can in, so I'll move on to the next point. And Dr. Biswas has referenced it already, just looking forward to the future and what you'd like to see changing. We've got the Senedd election, of course, scheduled to take place next year. Big challenges facing key workers. What would you say the big challenges are to your sector as we look forward? And what do you see to be important in what the government should be prioritising? Shall I return to you, Dr. Biswas, because you started that point so well before? If we can investigate that a bit more.
Sure, thank you. I think the most important part which the Senate should be looking at from next year, by which time hopefully the pandemic should be improving, is looking after the most valuable resource for the NHS, which is the staff. They should be heard, they should be valued, they should be motivated, because without the staff voices being heard, you cannot make the right changes in the NHS. So they should be appreciated for all the work that has happened, and their input should be included in planning for the future of the NHS. Have had a different way of working. We have, for example, done a lot of virtual working at the moment. We have seen patients virtually rather than face-to-face in the clinic. So those are the kind of things. The pandemic has accelerated the changes, which is in a positive way, and this is something which we need to develop. So at the moment we are doing more clinics which are virtual, and that can be a very positive thing going forward. We need to have more investment of try to move the services more from the hospital into the community, because treating patients more in their own homes with the support in the community is something which will be vital going forward. And more emphasis on elderly care and rehabilitation, because at the moment that is often a neglected specialty, and that will be very useful going forward. The other thing which is required going forward is to stop working in silos, because at the moment the health and social care are completely separate sometimes, and almost you feel like the health has to be sorted out before you move into the social care. But that has to be joined in, that there has to be a lot more joint working, so that when a patient comes in, when a person is seen, that person is treated as an individual, and the health and social care has to link up very well. And using technology, because I think we have been exposed to a lot of technology during the pandemic time. So we should be trying to develop that technology, investing in it, so that we can use that technology in the future. So I think there has been, instead of all being doom and gloom, I think the pandemic has shown that there is a lot of potential of different way of working, different model of working, which I think we should all try to develop on going forward. And I think there is a lot of evidence to say that a lot of this works. So I think there is something to go forward to positively on that.
Thank you very much, Ahmed. Would you say the same? I know that you spoke before about it sometimes being quite challenging trying to solve people's problems and talk to them over the phone or remotely. So what things would you say are the big challenges going forward, and what can we embrace of what has gone well, and what should the government be concentrating on of those things?
As an imam who's working in a place of worship environment, I'd say the biggest challenge we will continue to face is lack of funding, as places of worship survive on public donations. And however, since we have seen a huge drop in donations, this has affected all services run by the centre, including food bank, women and youth support services. As places of worship, they do play a vital part in keeping the spirit and the momentum within society. Also, it is very important, I agree with Raja, it is very important for key workers, especially including those who work in charity entities, to be recognized. People who are engaged in community work needs to be recognized, as they are the silent, I call them the silent community service providers. And in terms of what the government should do, we have been reflected upon many aspects during this pandemic. I would request from the government to work closely with sectors who aims to improve the health and well-being of members in society, and to see how they can work together in order to benefit the community in a long-term perspective.
Thank you very much. And Rachel, Dr. Biswas spoke earlier on as well about that link between health and social care, which I'm sure you'll want to pick up on. And also the use of technology, which I know you've started doing as well. So presumably you want to see more of that and get the momentum to quicken on those things.
Yeah, and you know, like Dr. Raja said, we need to be able to work together. And I think, again, when I speak about how skilled these staff are that work in the care sector, I think it's important that we spend time upskilling them as well. I mean, it's coming into guidelines now that all staff working within the care sector have to have a certain level of education, which I think is very important. But again, I think, you know, in the past, we've had a lot of visits from doctors or from nurses from the local hospital. We're based just down the road from the local hospital in Llanelli. And again, a lot of those things are now being expected of our staff here. So why don't we upskill them and give them that in the long run? All of my staff, you know, they're all dedicated to what they do, and I know that the majority of them would be very keen to be upskilled and be able to do this on a longer term basis, which in turn will take some pressure off Dr. Raja and his colleagues in the hospitals. And I think something that's a big concern here and across the board with care homes at the minute in moving forward with this pandemic is how we reunite our residents with their families again. That's something we have to look at, you know, here and of course in the hospitals as well. I'm sure Dr. Raja has got experience of that, and like Ahmed said as well, you know, there's nothing like the personal touch. There's nothing like holding the hand of your loved one or being able to give them a cuddle. And we do that for our residents, but that's not the same as them being able to see their daughter, their son, their husband or their wife. You know, we've got residents whose loved ones have passed away during this time, or we've had residents who have passed away during the pandemic, and having to make that phone call to a relative and say where we're at. It's not a nice place to be. And going forward, like Dr. Raja says, you know, elderly care is often forgotten, and it shouldn't be. You know, my passion is that the residents we've got here and everybody within their generation, they've given so much to our communities. They've given so much, and they do not deserve to be forgotten. And I think something that has shown during this pandemic, especially during the early stages, is that that's exactly what they are. And it shouldn't be that the NHS or that the care sector are fighting tooth and nail for our elderly. It should be that we are all fighting for them. Their care and their importance should be a concern of us all. So I think, you know, that's something that has to come from this pandemic, is that they can't be forgotten any longer. They need to be at the forefront, and like I say, over anything, they need to be with their families, because whilst they're not, it's stopping families from wanting to put their loved ones into care, even though that's what's needed to meet their needs. And the long-term effects of that, the long-term effects of keeping people at home who need 24-hour care, it's not going to be good. It's not going to be good. But but I totally understand why they're doing it, because if it was my loved one, if it was my grandparent, I wouldn't like being faced with her having to go into 24-hour care in an establishment where I'm not going to know when I'm going to see them again, or if I'm going to see them again, and that can't go on. There has to be a solution to that.
It's such an impossible choice, isn't it? And I know that we just, you know, have so much respect for you and what you're doing, which is holding those hands and being there when people can't be, when people are in your care. So yes, just to echo everybody's thank yous, really. I've noted down a few things there just from what you've all said so far: appreciating staff, valuing staff, funding, recognition, training. Mina, would you agree with all of those things? Is there anything you would particularly add as well from the viewpoint of education?
Byddwn ni'n cytuno â rheina I gyd bob un. Byddwn ni hefyd yn gobeithio y bydd y pleidiau yn edrych ar safbwyntiau'r Senedd Ieuenctid, a hefyd Llys Genhadon Sally Holland, sydd yn trio dod â iechyd meddwl yn flaenllaw y meddyliau bobl, oherwydd yn yr un ffordd mae Rachel yn sôn am yr henoed a'r ddioddefaint ofnadwy sydd wedi bod i'r henoed yn y wlad. Dwi'n meddwl mae bobl ifanc mewn ffordd wahanol ac ar lefel wahanol. Mae wedi bod yn gyfnod anodd iawn iddyn nhw hefyd, a mae cael mynediad at wasanaethau sydd yn gallu rhoi cymorth I bobl ifanc wedi mynd yn anos. A dwi'n meddwl mae pwynt Ahmed am siarad yn bersonol gyda bobl, dwi'n cytuno'n llwyr gyda fe ar hwnnw. Mae gallu bod gyda rhywun mewn person mor wahanol I siarad ar y ffôn gyda rhywun, pan weithiau I chi'n gallu darllen gymaint mwy mewn I beth sydd yn digwydd y mywyd, rhoi edrych arnyn nhw na fydd na beth mewn beth maen nhw'n dweud wrthoch chi. Felly dwi yn gobeithio fydd iechyd meddwl yn cael mwy o sylw ac mwy o ariannu mwyn I wasanaethau fel CAMS medru rhoi mwy o gefnogaeth I bobl ifanc.
Thank you very much. Is there anything that anybody's, as you've mused on that point, anything else that you would add to your Christmas list, I suppose, for your sector for next year? What would really help you?
Can I just add one more point, please? It's the fact that we have concentrated so much on COVID for the last 8 months that we have almost ignored, or not ignored, but not been able to provide the service for a lot of the non-COVID patients. And the waiting list for almost all conditions, operations, everything has gone up. There are people who don't have COVID who are suffering in the community. And unfortunately, because of the infection rate being so high in hospitals, all hospitals in the UK, it's not been possible to deliver the services which all of us want to. So I think the biggest challenge going forward will be, how do you get that waiting list down and do the things for the patients who has been waiting for a long time to be looked after for their normal other illnesses, operations and other things. And how do you continue, because a lot of staff are really reaching the end of their ability to work because of the long period they have been going around this treadmill. So having that support for the staff going forward is going to be quite crucial if we are going to be able to deliver that for everyone.
And of course, we know that that's not just months, that's years in terms of getting on top of waiting lists.
Absolutely.
I just want to turn to some of the comments and the questions that are coming in. And one about food banks. What impact did the lockdown have on the amount of users of the food bank, Ahmed?
Yeah, food bank have been dramatically affected, and even the number of users of the food bank service has also dramatically risen. I remember in one day during the peak of the pandemic, we served around 200 people just in one day. And in accordance to a survey, a report was made by IFAN, the Independent Food Aid Network. They said that 177% increase in the number of emergency food parcels distributed by independent food banks between May 2019 and May 2022. We have seen this effect, and we have seen that the number of people is increasing dramatically. And I go back again to the if it wasn't for the help from the community and the positive response from the community, I think we would have not been able to continue providing these vital essential services to the community, because we we managed to provide deliveries for those who are self-isolating. We then pick up prescriptions and delivering prescriptions to their homes. We then the shopping, especially for the one who's either self-isolating or the vulnerables. And that is because of the spirit that we had from the community. And we thank everyone who volunteered and everyone who contributed to this service. And also, again, the lack of funding restricts, the ability to provide such service. I remember once, few times, we had to turn some of the food bank users away because of the lack of unavailable food parcels, and that is because of the lack of funding. But it has been affected tremendously, and then hopefully we try to find solutions for this in order to either waive the food bank altogether, which could be a bit difficult, but at least to have to make us in a position where we are able to continue providing the food bank service to the community.
And this is actually a really good point, having picked up on all those things which you've been doing to keep the community going, all of you, to mention that there's a community champions gallery as well, which is another initiative, another project that's been going on alongside all these things. And that's where members of the Senedd picked out 3 people from their constituencies to have portraits done and photographs done to be part of this community champions gallery. So if you want to see those pictures, they're all online. You can access those through the Senedd social media sites. So that's something I'd encourage everybody listening to do as well, to carry on the celebration of what key workers have been doing. Let's just pick up again on some of the questions that are coming in, and one for Dr. Biswas. There's a question here which is referring, oh, has it gone away? Is it there? Oh, that one might have just disappeared, but I've got a really nice comment actually that's come in, which is from another NHS doctor. It was referring to what we talked about initially, actually, at the beginning of the session. And they said that when they've been doing their clinics remotely, what was really encouraging was that every patient that they've spoken to by telephone or video call, as well as face-to-face, has always asked them how they are doing. Do you find that as well, that everybody's also really concerned about your well-being?
Absolutely. Whenever I have done the remote calls or video calls or telephone calls, everyone always asks, how are you feeling? How are you doing? And that's so nice. At least, more than compared to some people, we are healthy, and to be asked by someone as to how we are coping and how we are doing, that really boosts your morale and makes you want to do more. I think it is really nice when that is asked.
And would you all echo that? Do you all feel like you've had those kind of questions asked about your own health and your own well-being throughout this, and people are really, really concerned?
Yeah, definitely. I mean, like I say, we've had to make some really difficult phone calls during this time, and the response is always, oh my gosh, how are you doing? How are you feeling? How are you coping? And I think, again, that's just the community spirit that this pandemic has brought. And I think that's the positive that's come from it, is how much everybody has pulled together and worked together and respected each other, really.
How do you feel that your particular roles have changed? How do you see them changing as the things you'd like to keep from these changes and the things you'd like to get rid of? What would be your top of the list of something in your particular role that you would like to keep? Mine is Davis.
Dwi'n meddwl bod y sgiliau technolegol i wedi gwella'n sylweddol iawn ers mis Mawrth. Dwi'n meddwl bod ni wedi dysgu llawer iawn o ffyrdd gwahanol o ddysgu plant sydd wedi bod yn grêt ac yn addas iawn ar gyfer y cwricwlwm newydd sydd yn dod. Mae hwnnw'n sicr yn rhywbeth i ni'n falch ohono fe. Dwi hefyd yn meddwl yn amgylcheddol ac o ran lles staff, mae'r lot llawer o deithio yn digwydd. Fe fues i mewn cynhadledd ddigidol wythnos diwetha, fydde wedi golygu teithio lawr i Gaerdydd, yn gadael am trên 4 o'r gloch, cyrraedd am 7:30 y nos ac yn teithio nôl y noson wedyn. Ond yn lle oedd e'n digwydd ar-lein a oedd dim angen teithio, sy'n llai o gost ac yn llai o flino hefyd. Felly mae'r ochr amgylcheddol, mae'r ochr addysgol, mae yna bethau ymarferol hefyd, dwi'n meddwl. Pethau fel amserlenni, plant ddim i gyd yn cael cinio ar yr un pryd, clychau'n canu a 1,200 o blant i gyd yn symud trwy'r coridor ar yr un amser. Felly mae yna wersi ymarferol y byddwn ni'n dysgu ohonyn nhw. A dwi'n meddwl fe fydd yna bethau fyddwn ni'n parhau â nhw. Felly oes, yn sicr mae yna wersi i'w dysgu ar lefel bersonol. Fe nes i fwynhau peidio rhithro o gwmpas bob nos, peidio gyrru'r plant i wersi pêl-droed neu nofio. Felly mae yna le i feddwl am balans bywyd gweithio rhedeg o gwmpas hefyd, dwi'n meddwl.
And I think you're right. I don't know whether a session like this would have happened far so easily, of getting us all together if we couldn't do it online. So that's really, really great. And I know that you've talked about, well, here today we've asked you what you would like to see happen going forward. So there's collaboration going on and there's those questions being asked. But do you feel generally like that's happening enough? Do you feel like we're going to seize on what's happening, accelerate it? Are you being asked those questions by the right people? Do you feel like things are going to change and the right things are going to get taken forward? Rachel?
I hope so. I mean, you know, there's been a lot of discussion during this time with sort of the local health board and the local authority about how we do things from a social care point of view. And they're certainly asking for our opinion. So I hope that our thoughts are listened to. Like Dr. Raja sort of hinted at earlier on, you know, sometimes you need to listen to the answers, not just ask the questions, you know, and I think that's something that I really do hope we take forward. And something else is just the morale of the staff. I mean, the hell we've been through, especially back in March when, you know, we really did have quite a bad outbreak here. The morale of the staff, I've never seen such a high morale amongst the staff. They've all come together, they've worked together. And like Mynir was saying as well, the work-life balance, I think, you know, just being able to focus on your work and going home. And I think during this pandemic, there's been nothing left of me when I've left work. When I've gone home and my husband's working from home at the minute and I go home and he wants to talk and I'm thinking, oh, please, you know, just stay mute for just 5 minutes because you've had so much going into your brain in work. And when I go home and he's been on his own all day, yeah, conversation isn't the first thing on my mind. So I think that's definitely something that'll come for it, to not talk to my husband so much.
So we've got so used to being able to ask people to mute themselves or to, you know, we can't actually do that in real life, unfortunately. No. Press the button. Ahmed, is there anything you would like to add to that from your role? Are you being asked that question enough, do you think, about from your experience on the ground, because you're the one who has lived this in your community? Are you being asked enough about how to make those changes, what to keep, what not to keep, how we should change things going forward?
Yes, many questions, you know, many such questions that's been, risen to us, and but again, you know, like I said, the things that I would always tell them and say to them is look at the relationship that have created between, you know, entities and between different people. And then we also, found that even people, families who had a broken relationship, when this pandemic kicked in, their relationship began to reconcile and to be fixed alone and to be fixed to go back together. And the things that personally I enjoyed most, and I think I would like to keep after that, is the relationship that was created and established between us and the wider community, and the spirit that we had, because the number of people who came together supporting us, despite, like I said, you know, the relationship that, you know, we had previously. But after the pandemic, we've realized that the relationship has been improved substantially. And, you know, the number of people who have different religion and comes from different background, who put their effort into put their hands alongside with our hands. And yes, we've been having also flowers being sent, cards being sent to our center. We've been having text messages. We've been having comments being put on our Facebook. With the because due to the work that we do in the community. And the things I would like to get rid of is the current situation we are in. I hope it disappears as soon as possible, and allow people to enjoy their life back again how they used to back in their days.
Dr. Biswas, do you think there's any danger in the fact of making things too virtual almost, and we go too far down that road? That's a question that's being asked on the live Q&A at the moment. Is there a danger of that, do you think?
I don't think there is a danger of losing the human contact. I think at the end of the day, the human contact is what improves the health of a lot of people. So I don't think we have a risk of losing that. But at the same time, if you have to come to hospital just to have a consultation, for a lot of elderly people, it's a massive journey. You might have to book an ambulance, come into that ambulance at a particular time. You have to wait for that ambulance. You have to be dropped off. Then once you are seen, you have to wait for almost quite a long time before you are taken home. So for a lot of people who are elderly, who have frailty, who have multiple comorbidities, it's quite a strenuous journey to have a 10 minutes consultation or even 20 minutes consultation. A lot of that can be done virtually. That is much better way of doing things going forward. However, that is not true for everyone. There will be people who need to come to hospital because there's this human element which needs to be there as well. So I think this will supplement, it will never replace, it will supplement the care which we are giving. And that will help in bring the waiting list down, because if we have a long waiting list, you can probably see more people virtually and at least answer some of the queries and do some of the things in the future, which will ultimately help. So it's only a different model of working. And I think the pandemic has just made us aware of other ways of working and doing things a bit differently, which we weren't so confident before.
Yeah, it's good to hear so much positivity around that. We are coming to an end now, so I'm going to be strict with just asking you for a sentence for the last answer from each of you. But as we look to 2021 and a fresh start, hopefully to a degree in the new year, with the hope that we've got of a vaccine, etc. Just one phrase or one sentence to say what your big hope is for 2021 for your sector as a key worker. What's your hope? Let's go to Ahmed first.
I'd say better well-being and healthcare.
You were to the point. I like it. Thank you. I'll ask you all to do the same. Rachel.
I think for all of us, for COVID to go away and leave us alone, and off the back of that, just continue the community spirit and the relationships that we've all built, I think, and just go forward.
Yeah, certainly that community spirit has come through loud and clear during the last hour, and it's been so refreshing and uplifting to hear. Myned Davies, what would your big hope be?
Tegwch I ddisgyblion yn arbennig y disgyblion hynny sydd I fod yn sefyll arliadau tygau y lefel A, felly tegwch iddyn nhw a gwetnwch a lles plant yn flaenoriaeth.
Thank you. And Dr. Raja, last but not least, if you want to end the discussion this evening with your hope.
I would hope that we learn to appreciate the NHS more. And even though NHS might have some problems, some issues, I think, and having worked in another healthcare system, this is the best healthcare system in the world. And that's because of the people who work in it.
I'm sure none of us would disagree with that. Thank you very much. And you've called for more appreciation there. And I would like to say that we wholeheartedly appreciate all of you and all that you've been doing throughout the last year. And we hope you've still got some strength left to continue that as we go into 2021, where there will no doubt still be some challenges ahead. And certainly over the months and years to come, I'm sure it will change the lives for a lot of us for a long time still. But thank you so much, and keep on doing what you're doing. And this really is a celebration. I hope you've felt that it's been a celebration, and you've been able to talk about the things that matter to you during this last hour. Is there anything that any of you really want to add, any burning comment which you haven't been able to say that you'd just like to throw in at the end? Let me just give you that opportunity.
Thank you, Andrea, for your time.
Yeah, thank you very much. Thank you to all of you.
Thank you very much. Thank you as well.
Well, it's been a pleasure to talk to you all outside of a news setting where we're just doing those brief reports, and just to hear a little bit more about what you've been doing in your lives over the last few months, and to really hear from the personalities and the experiences on the ground. So I've really appreciated it as well. So I think at this point, it's just time for me to say, go and enjoy yourselves for what's left of the rest of your evening. Hopefully you're not working, and you've got a chance to put your feet up. Good night, everybody. That's my plan.
Thank you.
Okay.